Hey everyone. So the topic of tonight's live stream is thread lifting, know before you go. My name is Dr. Lisa Vuich. I am doing this Renew MediSpa Insider series as a form of virtual consult. So the goal of this series is really to make sure that you, as the patient, as the consumer, what have you, really have all the information and really have enough to know how to evaluate something, whether it might be good for you, and more importantly, know what questions to ask about a particular procedure so that you really know what you're getting into. So again, I am the medical director and owner of Renew MediSpa and the Renew MediSpa Training Institute. And we actually teach physicians and nurse practitioners how to perform these thread lifting procedures. So we do have a lot of experience. I've been doing thread lifts since 2015. And I really want to impart to you the essentials, the basic knowledge, and give you a really good background in what thread lifting is, what it can and cannot do. And I hope that I answer all of the questions you may have. If I don't, you can always contact me. I am a master aesthetic trainer, both for Renew MediSpa Training Institute and for Specialty Med Training, which is a training institute located in Florida. I am a key opinion leader and trainer for Mint PDO threads. I also train on silhouette and still lift sutures for those of you who may be physicians and nurse practitioners. And I remain very active in the non-surgical aesthetic and regenerative medicine space. Renew MediSpa, as you may know, is located in Derry, New Hampshire. It's about 45 minutes north of Boston. We have been a winner of the best spas with Hippo magazine readers, if you're familiar with that, every year since 2015. So we're very proud of that and very dedicated to providing the absolute best in terms of quality service. Know before you go with respect to thread lifting. What does that mean? Basically, the main points I want to communicate to you, and not necessarily exactly in order, are these. When we talk about thread lifting, of course, we want to know, is it new? Is it a safe procedure? What does it really do? What can it do? What's the difference between lifting threads versus smoothing threads? What about adding platelet-rich plasma, which is your own growth factors? Will the procedure hurt? How do you prepare for it? What about the aftercare and the downtime? What can you expect from that? How long will the procedure or the results last is another common question. When should you consider doing a thread lift? And of course, what about combination therapy? Where does this really fit in the overall scheme of non-surgical aesthetic procedures? In other words, really part of when should I do it? How do I organize this? How do I fit it into my mindset of something I might consider as an anti-aging procedure? So tackling the first question, is thread lifting new? The answer is no. The use of thread lifts in modern facial aesthetics, actually in the US at least, dates back to the 1990s. In Korea and Europe, it dates back even way before that. The initial thread types in the US were actually a brand called Aptos and Waffles. These were permanent sutures that had significant complications. So sometimes when you do a search on the internet about thread lifting, you might pull up information about thread lifting procedures of many years ago, like the Aptos threads, and you might see some negatives and complications around that. But understand that not all thread lifting, is the same, and there were older versions of the procedure and much more recent versions, which are much safer and with fewer complications. What really changed things is when in the US, we got our hands on threads that were made of a substance called PDO, which stands for polydioxanone. This is a dissolving suture material that actually has been used for decades in suturing wounds in the OR. What's different is that we now have threads made of this material that we can use in non-surgical facial aesthetics. Now, Mint PDO, M-I-N-T, is a particular brand of PDO suture. Mint stands for not minimally invasive non-surgical thread. That is one of the brands that I commonly use. Their first FDA clearance dates back to 2013, and they got a more recent one, I believe, in 2020. Now, I first trained in PDO threads back in 2016. And back then, we really didn't have many options for training in the US. They were pretty sketchy. So I actually had to travel to London to train with Dr. Bob Khanna there on thread lifting. Fortunately, these days, we have more going on with threads in the US, more local trainings that make sense for people. But back then, that really wasn't the case. Now, if we get really specific about threads, They're even older than what I just mentioned. In fact, the ancient Egyptians probably were the first to use embedded threads in order to enhance facial rejuvenation or collagen stimulation. There are references actually to gold threads being placed under the skin in ancient Egypt, perhaps even to improve the appearance of Cleopatra. What is new about thread lifting, if you will, is that in the past few years, there have been advances in thread design, in thread what we call vector diagrams, which I'll explain in a little bit, that have really advanced what we can do with threads and how much we can achieve. So if there's something new about PDO thread lifting, it really has to do with advances in thread design and in how we place the threads, but not really in the thread materials themselves. Next question, is thread lifting safe? Thread lifting is a minimally invasive procedure, which is very safe if it's performed by experienced hands. These materials are quite biocompatible. That means they're designed to dissolve over time, to not incite too much of an immune response from the body, just enough to build collagen, not enough to cause a problem. And they don't generally cause scar tissue. They are introduced through a very small needle poke, which I will show you. That needle poke is generally about the size as a needle poke that you would get if you got an IV in the emergency room. All right, so we're not talking about big entry points or something that's likely to leave a mark. Hundreds of thousands of thread lift procedures are performed yearly, even just in the United States. So we have a lot of track record with this procedure. The most common side effects with threads are fairly similar to those we see with other familiar procedures like dermal filler, things like bruising, post-procedure soreness, swelling, very rare infection, because anytime we break the surface of the skin, we might see an infection. Although I can't recall the last time I treated an infection as a result of thread lifting. Side effects which are unique to threads might be things like a surface dimple, a surface irregularity, something temporary, or perhaps a thread moves or shifts, or as we say, migrates. That's always possible. And if that happens, a thread might be poking under the skin. These types of potential adverse effects are manageable with things that are readily available to us in non-surgical aesthetics. Every once in a while, we'll have to make a poke, trim an end of a thread, but in general, these are not dramatic downtime sorts of things. Now, threads, unlike dermal filler, can't block a blood vessel necessarily. So you might argue actually that threads are safer than filler. So even though you might view it as something a little more exotic or as an unknown and therefore sort of scary, when we as aesthetic providers compare threads versus things we already do, we say, hey, this is in some ways safer than something we do even more frequently. So I hope that's clear. So what does thread lifting do? To understand that, you need to understand just a little bit about facial anatomy and about facial aging. So with facial aging, we certainly have volume loss. We have changes in fat pad volume, especially in this mid-face region, but also in the temporal region and elsewhere on the face. We have a change, as you see in that image on the right, change in shape of the face, where we get more squared off. We get a little more jowling, a little more prominence along the jawline. We want the focus to be up here in that high cheekbone look. And then suddenly as we age, the focus is down here along the jawline where we don't want it. The next thing that happens is collagen and elastin loss. So we get thinner, looser skin with fine lines, of course. We have some bony resorption that happens over time that we can't do anything about. Even a surgeon really can't impact bony resorption. Importantly, we have loosening of facial ligaments. If you look at the image to the left, if you look at what's highlighted in white, a lot of that is facial ligaments. Think of ligaments almost like tendons, if you will. They are very strong connective tissue structures that are anchored on bone in the face that serve to like a shelf. They serve to hold things up. And as we age, those ligaments go loosey-goosey and they start to sag. Now, we can't really compensate that much for ligament sagging with things like dermal filler, and we can't do anything about ligament sagging with things like Botox. However, ligaments that are sagging can be nudged into a more lifted position with something like PDO threads. So that's what we're going to be talking about here. There are some other things that occur like loss of muscle tone, like temporal hollowing. Again, some things we can impact with our facial non-surgical aesthetics, some things we can't, some things we can't even impact with surgery. But one strength of thread lifting is that we can take advantage of these ligamentous structures and even elevate them, lift them back up into a more elevated position, and thus restore a more youthful appearance to the face without a scalpel. So what do PDO lifting threads or lifting threads in general do? Well, as you see from this example, we can get a fair amount of lift with carefully placed lifting threads of any type. So this illustrates what I call an advanced PDO thread lift. What does that mean? Advanced just means we did a lot of threads in a complex pattern from a site that was pretty far back. So we got probably up into the hairline here. As you can see in that image on the right, our threads started actually over the ear. And that's important because you get more lift the further back you start. We were able to improve her facial contours, her jawline, her cheeks. We're able to stimulate collagen. We definitely added smoothing threads. We did some platelet-rich plasma, which I'll explain in a minute. But essentially, we did a big procedure on this particular model, and we did this without the use of a scalpel. This is not a surgical facelift. There was no suturing, no sewing, nothing was cut. All of this was done through simple needle pokes. But as you can see in the before and in the healed or after image, that is not an immediate after. We'll talk about immediate afters. That is a fully healed after, showing us where things settled into. And I think that's really important to take into consideration. As you can see in these two examples, these are not as advanced a pattern, let's say, but even so, you can see a significant lift. In the example to the left, again, it's subtle, but it changes how light reflects off the face. So in our lovely model to the left, you can see that on her left image, there's more of a sagging or a heaviness in the jawline. And on her right or fully healed procedure, you can tell that's not an immediate after. There's no fresh needle poke there, right? You can see she now has a more distinct jawline. You can see that light is starting to reflect more off of her cheek, and she just has a more youthful appearance. There's actually a shortening, okay, an actual shortening of this mid-face, which makes her look more youthful. So she's got a longer, heavier look on her left and a shorter, more lifted look on her right. In the image on the right, another model, one of my employees, Danielle, we did just a simple cheek lift, so a lesser procedure. But again, now this is an immediate after, so there's a little bit of swelling, but you can see with Danielle, suddenly the light is reflecting more off the cheek and less off the nasolabial fold. And that's the key for your photos and your selfies and your what have you. And when you're looking in the mirror, suddenly you look more youthful. You're not sure why. It's because you've got restoration of that mid-face support. And it's not rocket science. It's just repositioning the volume that is already there. Jawline contouring is perhaps one of the most popular indications for thread lifting, especially PDO thread lifting. So I show you an example here. Again, this is before on the left, fully healed on the right. And on the far right, I gave you just kind of a little pattern. Now, this particular model is someone who had done threads with me before. So we had already lifted her cheeks. And in this particular procedure, we were simply going for more of a tug on the jawline. And you can totally achieve that. We did just 4 PDO threads to the jawline. These were mint threads. So what is the advantage to this procedure over something else? Well, number one, you have some instant gratification and you have fairly minimal downtime, okay? There's not a lot of swelling. There's not a lot of bruising. There's some activity restrictions, but not heavy activity restrictions. So you can very quickly get a more lifted look. Now we contrast this with perhaps like an energy-based procedure like therapy or profound RF, or you can throw in any heat-related procedure meant to tighten. What's important to understand about tightening procedures is, yes, they do tighten, they do shrink the envelope of skin some, but they won't actually pick up soft tissue in the most cases. So they're really distinct from thread lifting, which can actually reposition the jowl a few millimeters. Now, this patient will enjoy continued improvement over time. That's important. And alternatively, if she didn't want to have anything placed under her skin, she could certainly consider skin tightening procedures, which would do something, but not reposition quite as much as PDO threads. In the upper neck, another very popular use of PDO threads, we are able to both snatch the jawline and get some improvement in this turkey neck area with minor swelling, possibly bruising, again, generally minor. There is some downtime with neck in particular. There is some temporary skin gathering that will occur, especially back here. And I don't know if you can really tell that in the right-hand image. I might have one that shows it a little better. But as soon as we pick the skin up, you can imagine there might be a little bunching here. It is just temporary, but it's something to be prepared for. Another thing to understand with PDO thread lifting is that if you're looking at an immediate after picture, basically, there will be a temporary overcorrection. And that means things are going to look a little bit better than what they're really going to settle into in 3 weeks or 3 months. And that's important to take into consideration when you're thinking about these procedures. Once again, these procedures are not a surgical lift. If you are a surgical neck lift candidate, you can see a surgeon. Okay, I'm not promoting this as equal to surgery. This is simply an alternative, or perhaps something that could delay a surgical intervention if that's important to you. Now, thread lifting can also be combined with what we call smoothing threads, which I'll explain in a minute. We can combine it with botulinum toxin or Botox. We can also expect that it's going to improve over time as you develop collagen in response to the thread material being there. So generally, what I tell people is that a thread lift will look better in 3 months than it looks in 3 weeks. And that's because in 3 months, you've got the effect of the lifting of the threads, and you've also had enough time to start to appreciate collagen stimulation just from the threads being there. One of the most popular procedures with lifting threads is what we call a brow lift. Many people will come to us looking for what's called a cat's eye brow lift. On the internet, you'll see this referred to by a number of different terms. It may be called cat's eye brow lift. It may be called ponytail brow lift, or even fox eye brow lift. And we also do nose procedures that I'll show you. All of these terms refer to exactly the same type of procedure, okay? It is simply an elevation of the tail of the brow. And you can do that to different degrees, depending on if someone wants to just subtly elevate the brow, or if they're looking for a very exotic higher pull, we can often achieve that as well. But it all comes under that umbrella of cat's eye brow lift because we're focused on the tail of the brow. Here I show you a more advanced form of brow lift. Now, this is going beyond cat's eye, okay? Cat's eye, ponytail, fox eye brow lift. That is all referring to elevating the tail of the brow. But sometimes what we need to do is pick up the entire brow, right? From the center to the tail. So I give you a couple of examples of that here. On the left, again, before and during the healing stages, fairly well settled in, you can see in that image that the lid tissue, it's not surgically removed. Again, we're not comparing this to surgery, but there's enough of a lift that you're starting to be able to actually see the eyelid, whereas in the above before image, you couldn't see any eyelid. The skin was actually resting on the eyelashes. Likewise, in the center image, an advanced pattern, you see a client who basically half of her brow was sagging down and touching her lashes. Once she is fully healed from the thread lift I performed, you can now see lid show all the way out to the side. So that makes her look brighter, more awake, less concerned, less tired. However you want to couch that, her eyes will look more open. And that is simply as a result of the thread lift procedure. Now, the image on the far right, I'd like to spend a minute on, because again, I think one thing that happens with thread lift procedures is you see these posts online where it's before and immediately after, and things look like hyper lifted, hyper corrected, and you're like, wow, whatever. There's almost always an overcorrection with thread lifting. There's an over pull and over tug. It's a little bit intentional because we all as providers know that when we do that, things are going to settle down a little bit lower. Now, we cannot do that, but that just means you're going to lose a little bit of that instant gratification. But most of the time, we're willing to do that a little bit so that we can ultimately end up with a nice instant gratification result 3 weeks later. So in this 3-part image on the right, what I show you is a client before PDO threads, and then in the middle, you can see her immediately after. And that might be where it stops for, an Instagram or whatever post. And you see the but someone else might look at that middle photo and say, oh my gosh, her brows look squared off, or she looks shocked. She looks surprised. She looks overpulled. It looks weird. Like she's too shocked. But that's just an immediate after. And there's swelling and there's numbing medication in there and there's an overcorrection and all that. If you then go down to the third image down, you see where she is when she's actually essentially healed, right? So now I want you to, with your eyes, look at the top image and look at the bottom image, which is what I will say, where the thread lift ended or where it, settled into. That's a more fair comparison of what was the result of the thread lift. The image in between is, falsely elevated, a little too overcorrected, and not really the result of the procedure. Okay. It just happens to be what it looks like immediately after. So I hope that's clear about the difference in before and healed, and that intermittent immediately after that can sometimes be deceiving, either because it looks too good or it looks overcorrected or it looks weird or anything else. Immediate afters with thread lifting do not really tell you what that procedure did. Now, some of our clients have thinner skin, a thinner face. They're not necessarily great candidates for our heavier lifting threads. In these clients, I tend to reach first for something called silhouette InstaLift. And I won't go into that in too much detail right now, but just so you know, there is a softer, thinner type, more volume enhancing suture that we sometimes use. And sometimes I mix it up and use some silhouettes and some PDOs. But sometimes the face is not the best candidate for our heaviest lifting, and it needs a stepwise approach. And every once in a while, we'll go at that with these silhouette InstaLifts. And as you can see in this client, a before and after, both from the front and from the side, I think if you look, you can get that sense of a subtle plumping, no filler, just a subtle plumping that was the result of collagen stimulation from the suture itself. So we do have different types of suture materials that we sometimes employ, either alone or in combination. Thread lifting, believe it or not, can also be used for the non-surgical nose job. Now, this might be someone who either doesn't have a big enough deformity to warrant surgery or isn't interested in a surgical approach due to cost or downtime or risk. All right. They may be a candidate for a little bit of straightening and a little bit of lifting of the tip. And this can be accomplished with highly specialized forms of PDO thread. These threads are specific to the nose. We call them specialty threads because they've been designed especially for that region. And as you can see, hopefully, in these two examples of mine, we took someone who had a little bit of a nasal hump in the before photo in either case, and also a little bit of a dip of the tip. And with PDO threads, we were able to both straighten the nasal bridge and also lift the tip. And all of that is done through one needle poke after numbing, of course, right at the tip of the nose. So it's pretty neat and quite popular at Renew. Again, single needle poke entry, less than 30 minutes, minor swelling, possible bruising, but again, generally minor. Gives us a straighter nasal bridge, a nose which appears more narrow. Again, we're dealing with shadows and changes in highlights, and a lifted nasal tip. And that tends to be a very popular procedure. I mentioned earlier smoothing threads. Smoothing threads and lifting threads are made of the same material, but are entirely different in design. If you look at the image to the right compared to a pen, you can see how thin the cannula or needle is that's holding one of these threads, and you can maybe barely see the thread itself shadowing there. It is so thin. It is thin like a hair thin. We can take these hair thin threads and we can mesh them pretty much anywhere on the face, or in fact the body for that matter. These tiny threads are loaded on tiny needles or possibly cannulas, which are dull, and they can be introduced in an area where we have fine lines and we want to stimulate collagen. These really don't lift. They don't reposition. You might, if you use enough of them, get tightening in an area. You can certainly get smoothing and skin thickening, but they're not to be compared with threads that lift, that actually have, sort of a rough surface and can reposition that soft tissue. So again, same thread material, completely different thread application, and often used in combinations. They can also be combined with PRP, which is your own growth factors, to stimulate even more collagen. And again, with smoothing threads, minimal downtime. We can really target a tough to treat area, maybe puffy, maybe bruising in an area, but very easy to have done, and then go on with your day. Here I show you some pictures of smoothing threads in place. These are awesome for glabellar lines, or those angry 11 lines, if they're stubborn, if they're not responding to Botox quick enough, or if you just don't want to do Botox in an area, you can definitely get smoothing with PDO, smoothing threads. Stubborn forehead lines. Not everyone can do Botox in their forehead, or they get too heavy and their brows drop. Or maybe they hate the line right above the tail of the brow, which we really can't Botox much, or we would drop the brow. That sort of clown line, I call it, is a perfect target for smoothing threads. So again, they're especially useful for areas where you don't want more plumping, where you can't achieve what you want with wrinkle relaxers like Botox. Think about smoothing threads. And again, this is a very natural approach. The threads dissolve over the course of a few months. They do nothing but stimulate collagen. They don't cause scar tissue. They're quite easy to place. It's a lower cost procedure than many things and tends to be quite popular. We just do a little numbing with lidocaine, pop the threads in, and off you go. So again, another good way to target stubborn, fine lines. Here you see top left, a bunch of smoothing threads being placed in what I call necklace lines. They can be used in the lines above the lip. The smoothing threads can be used to support the tissue under the corner of the mouth you see there, or in this marionette region to kind of get a lift or get that to fill in. And the image on the right shows you a cartoon of how placing a smoothing thread works. Essentially, it's loaded onto a needle or a cannula, which allows us to introduce it under the dermis. We then pull the metal part out and the thread is left behind. And that thread will stimulate new collagen development for as long as the thread lasts. Beyond Botox, again, it can target lines that Botox cannot target. So in this case, we have very deeply etched forehead lines that are likely to be beyond Botox. We also have a very prominent line over the tail of the brow. Not a good target for Botox, or we drop the tail of the brow, but a very good target for smoothing threads. And also, even in the crow's feet, especially these lower crow's feet, there isn't a day that goes by that I don't explain to someone who's getting tox. Listen, this is going to smooth things up here, but this bottom line here, when you smile and everything bunches up here, tox isn't going to do much for you down there. And I can't tox the muscle that's causing it, because that's your cheek muscle, and I can't make you look like you had a stroke. So if you have lower crow's feet lines that are bothering you and haven't been addressed by Botox, you may want to ask about smoothing threads. I mentioned platelet-rich plasma. I'm just going to explain that very briefly here. It's not a PRP talk here, but platelet-rich plasma means that at the time of your appointment, we draw a tube of blood, we spin it in a centrifuge, and we get rid of the red cells, as you see in the center. We then may spin it again, depending on which kit or system we're using. But the bottom line is, we're just taking a fraction of that blood that we've drawn out of your arm right then and there, and we're taking that fraction, which has your platelets, which are chock full of growth factors to stimulate collagen, and we're then taking those platelets and injecting them wherever we want collagen to grow. So it's a great procedure to combine with PDO threads of any type, be it lifting threads or smoothing threads, to get a double whammy, double collagen stimulation, very synergistic effect, and anti-aging. Now, lifting thread types does matter, and brands even can matter. But the most important distinction I want to make here is between the lifting threads. So we have lifting threads like the Mint, which are what we call molded barb threads. That means the barbs, which just means the grabbers. There's no metal involved here. This is not barbed wire. But the grabbing portion, as you can see in that left column, like the Mint threads, is actually fused onto the thread itself like a rope, right? A rope with fused irregularities, right? That is very different in construction and in strength than what we call a cut barb design. Many PDO threads on the market are cut barb. They're laser cut barbs. Now compare the column on the left with the column on the right. Okay, when a laser creates cuts in that thread rope, if you will, that also interferes with the integrity or the strength of the rope. So it should come as no surprise that the cut barb threads are not as strong, do not last as long, and do not lift as much. Does that mean cut barb threads are evil? No, it just means they're not going to produce the same result. They're not going to lift as much. The result's not going to last as long. The important thing is that you as the consumer know there's a difference and you know what you're paying for. So that's a good question to ask if you're evaluating whether to get thread lifting done somewhere. You could ask that provider, do you use molded barb threads or cut barb threads? And so at least then you know what category of thread lift you're in, either advanced or basic. And that may impact your decision as to whether to get threads done at that location. So we call them barbs, but there's no wire, no barbed wire. It's the same thread material. It's just a rough surface. Some people will call them cogs, means the same thing. The threads also vary in terms of the number of grabbers or barbs on that thread and what direction they're pointing, left, right, both, unidirectional, bidirectional, multi-directional. Do you need to know what that means? Not exactly. Your thread lift provider absolutely needs to know what that means. And that's where we get into advanced thread patterns and advanced thread types. And this is the point where you need to kind of step back and say, okay, I'm choosing the artist. I'm not going to completely understand threads or thread design or what threads do like at that level. But just know that threads are not interchangeable. And the threads that one thread lift provider are using may be far superior than those that another thread provider are using. They may be highly advanced, more expensive threads versus cheaper laser cut threads. All of this factors in to the cost of the procedure. So it's something to take into consideration. The 3 brands that I use are listed here. They are Mint, or minimally invasive non-surgical thread. I also use a brand called Les Ancres, especially for their specialty threads, for the under eye, for the nasolabial fold. Also, I love their threads in those regions. And I also, as I mentioned earlier, use Silhouette Instalift, which is specially designed for thinner skinned, thinner faces. Will it hurt? Another big question we get. We always, with thread lift procedures, inject some lidocaine. Similar to that with dermal filler, but we tend to inject more lidocaine. with our thread lift procedures. And certainly you feel the sting of the lidocaine. After that, you pretty much will just feel pressure, an occasional twinge or a zinger, but nothing major. So this really isn't a superbly uncomfortable procedure. Topical lidocaine might be used, especially if you're getting smoothing threads placed. And again, you feel a sense of pressure, but not a heck of a lot. After that, post-procedure, most people will just use ice. There might be the occasional Tylenol use if needed, but this isn't something that requires all-out pain medication. Another common question that comes up is how long will thread lifting last? And I'm just going to run through a study that was published recently, I think it was 2018, right, that looked actually at a 2-year outcome of thread lifting with barbed PDO threads. And I go into this in more detail because you're going to find a lot on the internet about, you're going to find everything from threads do nothing to threads are the cat's pajamas and everything in between. And the bottom line is there is so much variation, and it so much depends on the type of threads that are placed and how many threads that are put in, that I just want you to have an appreciation for, take what you see on the internet with a grain of salt and speak with your provider in more detail about what they expect in terms of longevity from your threads. But in this particular study, they looked at a 2-year outcome, and they did do actual measurements, which I liked, of what the lift was that was achieved. And they also looked at patient satisfaction. So they were measuring degree of skin lifting in terms of millimeters in this study, and they broke the patients down into 3 groups. Group number 1 had only thread lifting, single procedure with barbed PDO threads. Group 2 had thread lifting 1 time, mixed with one other thing, be it filler, Botox, or platelet-rich plasma every 6 months. And group 3 wasn't allowed to have any threads at all. They could only just have the filler, Botox, PRP, triple combo. The threads they used were barbed, and they went to the cheeks and to the jawline, and they did whatever number of threads they needed to get the result that they wanted. When they looked at 1 year, over 95.5 or over 95% still showed 3 to 6 millimeters of lifting. That might sound like a lot, but in facial aesthetics, that's actually significant. And a small percentage showed even more lifting than that. And at 2 years, still a third of them roughly still showed what's considered moderate skin lifting in non-surgical aesthetics. Now, interestingly, in group 3, where there was no thread lifting, they lost all of their any lift they might have achieved at 6 months. So they weren't able to maintain that. What ultimately happened? In group 1 at 1 year, at 6 months, so group 1, thread lifting alone, all of the clients were highly satisfied at 6 months. And at 1 year, all were at least still moderately satisfied. All right. So we do have a high degree of patient satisfaction. In group 2, where thread lifting was added to another modality, similar at 6 months, but the people in that group actually felt a little better at the 1 year mark than thread lifting alone. So they were highly satisfied, but even more so if they had another procedure done. So the bottom line is this works well alone, but likely even better as combination therapy. When answering questions about how long thread lifting will last, one point I like to make is that recently advances in thread construction, which means the number of threads, the direction of the barbs, even the patterns of placement, like what we call vector design, have led to improved results and better duration of effect compared to years ago. And I would ask that you take this into account when looking online about, does thread lifting work? How long does it last? I mean, some of these studies or meta-analyses or et cetera were done at a time before the most recent thread designs and advances had actually come out. So you need to kind of keep that in mind. This field is changing, it's evolving, and we're seeing longer and longer durations of action compared to what we saw 6 years ago. So just something to keep in mind. The duration of results also is very much affected by, as I mentioned, the type of thread used. Is it molded barb versus cut barb? It's also affected by the number of threads used. I saw someone recently who came to me for threads and they were like, well, I'm here for threads. I had them done a while ago. It didn't really last very long, but I'm willing to give it another shot. I had my cheeks done. I'm like, oh, okay. Do you know what kind or what type? They're like, no, I don't really know. They were like, but they did 2 and 2. I'm like, okay. 2 threads per side is the most basic, lifting procedure. You're putting in a minimum amount of threads. It's going to have a limited effect and a limited duration because you haven't really done that much. Okay. That's a lot different than if you do a cheek lift with threads and you're doing 4 threads this way and 2 threads reverse vector. And, now we're talking about a whole nother level of procedure. So in this instance, it would be like you were trying to compare 10 units of Botox to 40 units of Botox. Okay. You're really not comparing apples to apples at that point. All right. So the number of threads and the thread design are going to impact how much lift you get and also how long it lasts. So it can be very complex, very difficult to compare procedure A at spa number 1 to procedure B at spa number 5. Okay, you might not be comparing apples to apples. Another important concept is that thread lifting will build on itself over time. What does that mean? The threads that we put in, particularly these thicker barbed threads, are stimulating collagen, and that collagen is going to outlive the thread. That collagen is going to be there way beyond when the thread has already dissolved and gone away. So what does that mean? As you do this procedure repeated times, multiple times, first of all, the lift can get better and better, but also the longevity, the amount of time you can go in between procedures starts to get longer and longer because you're stacking collagen on top of collagen on top of collagen. So the maintenance will get easier the longer you've been doing it. In the beginning, you might do more threads within 8 months, 12 months, but on the outside, after you've done it a few times, you might go 2 years. So it's variable, and that's just what I wanted to communicate. In general, I tell people, let's reassess the threads somewhere between every 8 months, every 15 months, and let's see if we want to throw a few more in or just sit tight, or what are we going to do? And in that way, it's a lot like filler. Let's kind of relook, reassess periodically, see what we need, and respond accordingly. It's really no different than that. But this concept of getting better over time is important. I like to use this example of my lovely model, Nancy, as someone whose experience with threads evolved over time and changed over time. Now, on the far left, you can see when Nancy first came to me in September 2017, she had fairly thin skin, fairly narrow face. I was a little bit more concerned about using heavier PDO threads for her. So initially, we did cautious volume replacement with fillers. We did Botox, of course, as needed. And we initially used those Silhouette Instalift sutures, those thinner, softer, volume-producing lifters that don't pick up as much as PDO, but do a good job for what they're designed to do. And you can see in her progress photo, the next one over, that we did a pretty good job. We got her looking more youthful. But by 2020, she had now built enough of a base, enough volume that we were actually able to graduate her to PDO threads. And then with the PDO threads, then even get her more lifted, more sculpted, a bigger pull, a sharper even jawline than what we could have achieved back in 2017. So this is a good example of progression, of combination therapy, and of changing our approach over time according to what's happening with her anatomy. The next question that comes up is, when should I do threads? Again, where does this fit exactly in the grand scheme of things? Well, basically, I want you to think of threads as simply another tool, as I just started to mention, in that big anti-aging toolbox. There's going to be a time and a place for threads. There's going to be, a certain pattern we're going to use one day that might be different than a pattern we use another day. We certainly want to think about simple things you can do at home in our toolbox, right? Collagen protection, sunblock, skincare, healthy lifestyle. We certainly want to use a judicious amount of dermal filler, okay? Threads don't plump the way filler plumps, but threads, as I'll show you in a minute, can get us away from over plumping, right? So we want to use our fillers to the point where things look natural. And then we want to stop with the volume when we've restored a natural looking volume. Our Botox, our wrinkle relaxers definitely have our place, but you can't do all the lifting with those alone for sure. Lifting threads are collagen stimulators and can give us a lift without giving us additional volume. And that's really the sweet spot. That is where you want to consider threads. If you're looking in the mirror and you're like, my cheeks are big enough, I just want them higher, you might be a thread lift candidate. And of course, another popular treatment, skin resurfacing, things like laser or skin tightening with microneedling, with radiofrequency heat, for example, or with ultrasound like therapy, peels, smoothing threads, all of those things are on the table as anti-aging tools. And all of this can be used in combination to naturally stimulate collagen and to delay these age-related changes in the skin. Preparing for a thread lift is all about combating bruising. So, you want to make sure you don't have a social engagement coming up that's going to be important, in the next few weeks because you may bruise. Maybe take 1 to 2 days off of work if you're concerned that somebody might know you did something, right? You're not going to look freakish, but if somebody's really looking at you critically, they're going to know 1 to 2 days after a thread lift that you had something done. Some people will take arnica or bromelain supplements. These are supplements that for some people reduce swelling and bruising. So those can be useful. You do want to plan ahead in terms of exercise because there's a period of time after thread lifting when you don't want to perform vigorous exercise. So factor that in. We'll ask you not to use makeup immediately after until those little entry points heal. We want you to come for a thread lift having had a light meal and being well hydrated so that you don't get lightheaded. And finally, freshly washed hair is very helpful, especially if we're working in or near the hairline, because we're not going to want you to wash that hair on the night of the threads, and that's important. And also, I tell people, try to be in between your hair color appointments because you're not going to want somebody like touching your head immediately after thread lifting because it's going to be sensitive. Post procedure, the same arnica, bromelain. You may want to get some soft ice packs. Again, that non-vigorous exercise is important to consider. You may want to sleep with your head elevated to reduce swelling if possible. We'd prefer that you not sleep on your stomach with your face in a pillow because that might, tend to shift things. In general, we tell people to try to plan a period of facial rest where you're not making huge facial movements. You're not going in for dental implants. You're not having a dental dam put in your mouth and things are stretched and distorted. We'd like to avoid that for a good month. Okay. So plan it around dental work. We don't want massaging to go on in the area. We don't want you putting a motorcycle helmet on that's going to smash your cheeks, right? Simple, if you think about it, very sort of intuitive things. If you kind of think through, okay, I just got lifted. I don't want forces on my face. I don't want forces on my face that are going to force things downward. If you keep that in mind, you're going to know what not to do post-procedure. And finally, be patient. Don't overanalyze your result immediately because threads do take time to settle in, to soften up, to integrate with your fat, for everything to kind of congeal and look appropriate and look more natural. So you want to give it time to heal. Complications with threads are fairly straightforward. They break down basically into what I call occasional, rare, and very rare. Okay, occasional complications might be a thread that's poking or pushing, right? This is due to perhaps a thread that shifted down, or as we say, migrated, or even wants to poke out. Once in a while, that'll happen with one of those little smoothing threads where it'll come to the surface and be like a whisker. And we tell people, don't worry about it. Grab it with a tweezer and just pull it out. If you have a thread, a smoothing thread that pokes out at the surface and is like a little whisker, you just grab that thread with a tweezer and it will slide right out and toss it in the trash. It's not a problem. Dimpling. Dimpling can be a normal healing process, if it's mild. Now, in that picture on the right, I show a heavy dimple. All right, that's a bigger, heavier dimple than what we normally see and might be more problematic. But even dimpling, if it's lasting more than 2 weeks, we have maneuvers that can smooth that out. So if it happens, it's not the end of the world. We can deal with it. A visible thread is much less likely. Visible threads are usually the result of someone placing the thread who's not as experienced, puts it too superficially, too close to the surface. Every once in a while, I'll have someone come in who's had threads placed somewhere and they were put too close to the surface. And we'll just sometimes have to go at that thread. I may even need to remove that thread, and it can be done without any significant pain. But every once in a while, we'll need to remove a thread like that. Rare complications include things like infection or a dot or mark at the entry point. It's actually quite rare. Usually my entry points, you can't even see once they're healed where that thread went in. But if you were to get a dot, we could take that out with laser without any problem. So that's something to be aware of. A hematoma is like a big bruise or a focal collection of blood. I don't think I've ever had that happen with threads. It's a reported complication. It is something that resolves over time. And finally, thread breakage. Again, it's quite uncommon for a thread to snap or break. If a thread snaps or breaks, the lower end is just going to migrate forward. If the lower end of a thread migrates forward, we just deal with that as if it's a poking thread, and it's pretty easy to deal with. So not a big deal. Very rare would be nerve irritation, a numbness or a tingling due to a nerve being irritated by a thread, and certainly something like a parotid gland or parotid duct injury. So a thread causing a blunt trauma to a gland in your face can happen, still temporary and also rare. So these would be the potential complications that you might expect and that would be listed in a, for example, a consent, and that would be listed in a consent form. So a few final comments. Remember, threads are part of combination therapy, okay? You're already beautiful. We just maybe try some things to make you more beautiful or to enhance your beauty. We have procedures that smooth and tighten skin, for example, like Profound RF, or another procedure we do called Total Skin. We have our dermal fillers. We have different ways to attack vertical lip lines. We have treatments that plump. We have treatments that stimulate collagen. All things to be considered. And PDO threads fits into that menu. Think of it like a la carte or things you can combine, okay? There's not a best or a perfect procedure. It's all about what would be the best for me, for my face, to address the concerns I have, taking into account what I can tolerate for downtime, taking into account what's my budget, and taking into account what other things I've done. So it's just part of that, that cookie, that sandwich cookie of things we put together to get the best possible outcome. But our goal is always to make you look more refreshed. I'm going to show you a video what thread lifting looks like in a brief video segment. Here we have a client. Now we've gotten her hair out of the way. We're planning now, what is the tug? What's the direction of pull that we actually want? Where do we want the tissues to mobilize to? This is called the vector pull. Some people refer to it as a vector diagram. It means that I'm going to shortly draw on the face. I'm going to draw the path of the threads, and I'm going to determine what's being lifted. This is a cannula-loaded thread, so most of the thread is located within that metal cannula. There's a little piece at the end poking out, and it's dull. So we plan out this vector diagram using a marker, and we basically draw on the face. What's the direction of the threads for this particular client? Now that vector may be up and down this way. The vector may be front and back, or as you see here, the vector may be a combination of the two. Here you see me using a little bit of a buzzing distraction tool, but also lidocaine to numb an exit or entry point. So someone having threads is going to experience some stinging from the lidocaine. And that's the majority of the discomfort. The majority of the discomfort from the procedure is from this step right here, which is the lidocaine numbing. We then put a little more lidocaine along the path of the thread, which is what you see happening in this instance. I'm putting some lidocaine along the path of a thread that is going to the patient's cheek for the cheek lifting portion of her procedure. In general, we just try to go slow, minimize the discomfort by not blasting it in there, just a nice, slow, steady injection to get both the start, the end, and all along the path will be numbed with lidocaine. Here you see me starting to pass a thread into the upper cheek. So I'm pre-molding the cheek with my left hand, and I'm passing the thread on that dull cannula through the cheek tissue to the end. And right there, I've held the tip, the metal is gone, and just the thread remains now in the cheek, which is elevating it into a lifted position. Okay, so the metal is entirely removed, the thread is in place, and the cheek is lifted. And we'll do any number of threads to the cheek, sometimes 2, sometimes 3, sometimes 4. And you can see as I tug on it, how much of a pull there is. Right here, I've now placed 2 threads, and I'm tying them together for added stability. Along the jawline, as you see marked out, we can go both above the jawline, we can also go below the jawline, and then we can tie those threads or twist them together to get more stabilization. So again, you see a thread on a cannula, which is then going to be passed along the line. All the patient is feeling is pressure because we've previously numbed the area. That shaking I'm doing is because the cannula is dull. It takes a little bit of encouragement to push through. And then I trap it and I remove the metal. And then we engage the barbs. Very simple, very simply engage the barbs. Press on it a little bit, press on it to engage the barbs. And we'll ultimately tie those together. And that's a before and an immediately after. Even lift just means I added also the platelet-rich plasma. So she's a little bit full from that platelet-rich plasma as well. And we did also address around her mouth. We addressed some fine lines with the platelet-rich plasma. All right. So how can threads help you? Well, the main way I hope threads help you is to avoid what we call pillow face, right? And you've all seen this. You've seen any number of celebrities just because they're the most exposed, right, on social media. But I've included a few examples here of perhaps what someone might call pillow face. The other common term for this is chipmunk cheeks, right? I can't tell you the number of times people come into me and say, I just don't want chipmunk cheeks. And I say, yes, I get it. I don't want chipmunk cheeks either, right? So the number one filler gone wrong thing that I see is not lumps and bumps. It's not filler blocking blood vessels, what we call a vascular occlusion. But the number one filler gone wrong complication I see is pillow face. That is someone who has tried to lift too much with volume. And as a result, their face looks, choose the word you want to use to describe this. You could say it looks plastic. You could say it looks overstuffed. You could say it looks unnatural. You could say it looks like chipmunk cheeks. You could use any term, right? So how do you avoid pillow face? Well, number one, ask questions, right? Express your concerns to your potential injector provider. You definitely want to see before and after images of clients they have treated, and you want to be on the lookout for that overfilled look. For that matter, what does the injector or procedure specialist look like themselves? Do they have pillow face? Now, my cheeks are a little full right now, but that's because I've got the COVID 15 pounds on. It's not filler. So, to be clear, I did try to pick images of celebrities who I didn't think it was a weight gain issue that was responsible for their full faces, but just look around, look at the injector themselves, look at their staff members. What do their staff look like? Do their staff look overfilled? That's a pretty good indicator of what you might expect from the practice. You want to evaluate your face at rest, but also with animation, with smiling. Do you feel like you look like things are too full? And again, discuss this with your injector, with your procedure provider. Talk about your concerns, talk about your hesitation, let your provider know that that's not a look you're going for. And finally, again, the brand of the thread matters, the number of threads matter, the placement of the threads matter. So you want to definitely be connected with someone you trust. Filler is temporary. Fortunately, most fillers are. It's dissolvable. We can always get rid of filler that is dissolvable and temporary if we want to get it out of the way before putting the threads in. So ultimately, as long as you're using temporary fillers, you do have what I call magic eraser, where you can undo something if it's been overdone. So that's a little reassuring. And again, consider thread lifting as a potential tool to help lift your cheeks, to help reform or restructure, redefine your jawline, for lack of a better term. And I want to say again, this is not a surgical result. This is not a facelift. These results that we get with threads are not facelift results by and large. However, they are often used by people who are looking to delay a facelift, by people who do not want anything to do with a facelift. They're also considered by people who've had a facelift in the past, and enough years have gone by, maybe 5 years, they're starting to see sagging skin again, and they're not ready or don't want to ever have surgery again. So keep it in mind as either something to delay surgery, something to avoid surgery, or something after surgery to enhance your facial aesthetics. Finally, I would like to let you know that we do at Renew MediSpa have what's called a model call. Now, model call means a couple of different things. Models, at least at Renew, consent to the unrestricted use of before and after images and possibly videography for teaching purposes or for education or for marketing. I mean, we're not going to be able to tell you as a model up front exactly how your images are going to be used. They might just be before and after photos on the website, or it might be a video clip. It might be something I use to teach doctors and nurses. I mean, I don't know in advance exactly how the images will be used, but as a model, you do sign off on use of the images. Now, models get a substantial price reduction. Sometimes they just pay a flat model fee. Sometimes it's a percentage off the procedure. If the procedure was going to be, X, the model might pay 30% off X, or however that works out. So a model call varies. We do currently have a model call for thread lifting. And this is our current model call for thread lifting is because there've been some new thread designs that have come out. We're interested in updating some before and after photos. We're redoing our website. So if you might be interested in being a model for thread lifting at Renew, you can contact us. You can go to renewmedispa.com, frankly, to any of our renewmedispa.com web pages, like the reviews page or wherever you happen to land. You can click on the chat box, right? The chat box image, and basically tell us, hey, I'm interested in being a model. We will then ask you to submit a selfie to at least initially determine if you're a candidate for threads, if you'd be a good model for what we have in mind. And we can let you know based on your picture and based on the model call we have going on at the time, what the cost would be for the procedure for a model. The other time or the other instance where we need models at times is because I teach physicians and nurse practitioners and nurses how to inject and how to perform thread lifts. So you may be able to get in as a model for a training date. That usually comes with an even deeper discount. So again, model calls are fairly routine at Renew. A handful of times during the course of a year, we will need models for one thing or another. It is currently November 1st, 2021. We do have a model call going on for thread lifting, Mint PDO thread lifting in particular. All of these procedures will be done by myself. This is not a training exercise for another physician or nurse. And you can go to our website again, express your interest. You can go to our specials page actually right now, which does list the model call details. So you can go there. So if you are further interested in thread lifting, if you are interested in being a model, whatever, what have you, I hope that you will contact us. I do hope that you found this information useful. But again, the goal of tonight was to give you the essential, most important information which you need in order to fully evaluate or reasonably evaluate whether you might be interested in thread lifting. To get more specific now, you need to do an in-person consult because thread lifting is a highly customized procedure. What you need really depends on where you're starting. In some instances, you have to do volume like dermal filler or something like it first. So really now beyond this point, beyond this video, you would need to get a personalized consult to discuss your goals, to go over what you've done in the past, where you want to get to, and then we can be more specific about helping you decide whether lifting and or smoothing threads makes sense for you. So I want to thank everyone who's tuned in. Don't forget, if you found this video useful, please remember to like it. You can comment on the video if you like, that would be great. Feel free to share the video and also subscribe to our YouTube channel, subscribe to our Facebook so that you can be notified in the future when we go live. So we're going live every 2 weeks on a Monday night. If you want to kind of tune in then, be aware that that's about when we do it. And I look forward to seeing you in future live events. Take care. Have a great night.